Serving 500,000 patients annually across the country, Gentiva Home Health is the largest health and hospice company in the U.S. They are also pioneers of the Safe Strides program, a home balance therapy program designed to address and reduce the number of falls among seniors. April Abele is the director of the Safe Strides program here in Louisville, and Eric Wint is the rehab director with Gentiva. April and Eric are with me today to discuss Gentiva and their Safe Strides program. Thank you for tuning into the program. And again, April and Eric, a lot of interesting conversation about the Safe Strides program and the just the value of it to our seniors in this community is phenomenal. Talk to us a little bit more for folks interested in this. What are some of the risk factors associated with falling among seniors in particular?
Well, there are so many, and that's why the importance of having a full evaluation is so important, to get out there and find out what these risk factors are. If you think about things like the components of balance, if you have a diabetes with a peripheral neuropathy where you don't feel those feet, you are actually 12 to 15 times more likely to fall. Your risk goes up by that much. And if you change a medication, a simple change of medication like adding an aspirin, you will actually increase your fall risk up to 72 hours after changing that medication. These are things we have to address. They're very important. We have to look at them. We have to figure out how we can prevent the fall in the first place, and really to get out there and to educate. To tell the person, you know what, you've really got to watch out for the next few hours, the next few days. Maybe we need nursing to come in and actually look at all of the medication components. Let's stop it before it happens. And if this component is going to be there anyway, if somebody has a peripheral neuropathy, to educate the person that maybe they do need to use that walker in their house. If you think about where people fall, it is typically at home. And what room in the house do you think people fall in? What room beyond any room in the house do they fall in?
I would say the bathroom probably.
Excellent. That is exactly right.
Yeah.
And if you think about it, okay, when are people rushing to the restroom? A lot of times in the middle of the night. And when that happens, they get up from bed and rush in there. They leave the walker at bedside, right? So now they're furniture walking is what we call them, going from one furniture to the other. Possibly there's something in the way. It's dark, so they're taking out that component. And, again, they're in a hurry. And in the bathroom, you got a lot of sharp corners.
Right.
That's where they hurt themselves. Or if you think about it in the shower, this is something that we don't typically think about. In the shower, if you're washing your hair, you close your eyes. You take out that component. So now you fall in the bathtub. There's no way to get help.
And one thing when we're talking about risk factors that we just can't stress enough is that if you are to that point where you are falling, you've really got to kind of put the pride to the side, so to speak, and let somebody know that. And again, whether it be your physician, a physical therapist, an occupational therapist, somebody, one of your healthcare providers, your family, those people, they want you to be happy. They want you to age appropriately. They want you to age healthy. The main thing is once you start to fall, please, I cannot stress this enough, let somebody know, because there are simple steps early on that can be taken to mitigate that increased risk, to start looking at some of these systems and get this thing under control before we start going into the realm of hip fractures and some of these other nasty things.
Well, you mentioned that the presence of a fall is the leading indicator of another fall taking place. You're more predisposed to falling once you've fallen. So for folks that are listening, particularly family members that may be concerned, hey, I don't want mom or dad to fall for the first time. What are some things that I need to be looking out for? April, you mentioned the furniture walking. Are there other things that family members should be identifying so that they can say, hey, I don't want them to fall the first time. Let's not wait till they've fallen and then call Gentiva and call into play the Safe Strides program. What else should we be looking for?
April touched on a couple of these before. One of them is just a kind of these avoidance behaviors. So if you notice that your family member is just not as active as they used to be, that's a real good indicator that that they might be having some at least fears or concerns about their own balance. Other things are, like she talked about, if you notice that they are kind of storing things not where they would typically store them, so things that they use on a day-to-day basis and normally they'd be in the cabinet or the closet, the drawer, now those things are sitting out on top of the counter. That's kind of an accommodation, that they understand that when they go to that drawer, I get dizzy, so I'm just going to set it right here because I know I got to use this thing to be able to live my life. So things like that, just, and really the main thing, and this goes towards their total health, balance, everything, is just when they start, when you notice that a family member is starting to become less mobile, that's a real good indicator that maybe we need to intervene a little bit and really try to dig in and figure out what's going on.
Gotcha.
If you feel compelled to help somebody up, if they're sitting in their chair and you feel like, I'm kind of rushing over to help this person up, that is a really good sign that maybe they do need help. But if we can help them get stronger, help them actually get up themselves, that is so much better for them. Independence. People don't want to lose independence.
Absolutely.
I don't. Nobody does.
Absolutely.
Right.
So we can help them get more independent.
Wow.
Stay in the place that they want to be, that they, the home they've owned for 40 years.
Mm-hmm.
They don't want to leave that. But if we can make them safer in that environment, that's what they want.
Let me give you a minute to kind of brag on your program for a minute. What should folks expect in terms of improvement, in terms of outcomes? How long should it take to see some improvement, that type of thing?
Oh, it can be very quick. Somebody who has maybe the visual deficit, we can work on very, very quickly. And I've certainly had people who've told me, within a week, this is getting better. And you could see it. If we're testing, we're getting this objective data for all of the components of balance. And then we test again, and that's improving. It's there. It's right in front of you. You're improving. They're reporting improvement. We can make them safer in one visit.
Wow.
And that's so important. If we need another discipline in there, we need to get them in there.
So you can see improvements right out of the gate.
Oh, visual improvement. One visit. You can see improvement, and the person is always so grateful, and certainly family is grateful.
Gotcha. Wow. April Abele and Eric Wint are my guests in the studio. April is the director of Gentiva's Safe Strides program. Eric is Gentiva's rehab director. We're talking about reducing falls among seniors. We'll take a quick break. We'll be back with the Aging with Options show and my guests, April and Eric, on 970 WGTK right after this.